Nanotechnology in Medicine. Nanotechnology is a field that connecting various disciplines like physics and chemistry via biology, from engineering to medicine that result in the development of new technological era. Nanomaterial, on the other hand, is the material which is produced in nanoscale, around 1 to 100 nanometer. One example of nanotechnology area is nanomedicine that is applied for molecular scale diagnosis, prevention and treatment of disease using the molecular knowledge of human body. MRI is a technique that utilizes a strong magnet and radio frequency wave to produce image of internal organs. Nanomaterial was used as contrast agent, which it will be injected into the body. The contrast agent helps surgeon to detect tumors more precise as the image produced are more clearer and better quality compared to MRI image without contrast. There is a development of metal-free contrast agent as the metal containing contrast agent might cause health problem. This is the example of MRI image without contrast agent and MRI image with high and low contrast agent. Photothermal therapy is an experimental use of electromagnetic radiation that is planned to treat various diseases including cancer. Photothermal therapy agent will be injected into the area where the laser will be applied. This activation brings the sensitizer to an excited state where it releases vibrational energy. The heat kills the targeted cells. This technique does not require oxygen to interact with the targeted cells or tissues. Latest studies also show that photothermal therapy can use longer wavelength light, which is not too energetic, thus give little harmful to other cells and tissues. Drug delivery nanoparticles are able to perform two critical functions, which are evading the body's normal immune response and reaching their intended targets. There are two types of nanoparticle delivery system, which is passive and active target. For passive targeting, it can be achieved by the permeability and retention effect. For active targeting, it was carried out by providing the delivery system with a homing device that are capable to guiding the carrier to the intended target. Nanomaterial also being used in tissue engineering. Nanomaterial is being made into scaffold, which it will be used around the bone's fractured area. Bioactive material is being chosen as it enhances the bone's tissue generation and reduce the possibility of body rejection and inflammatory. The scaffold is made porous, so it allows the diffusion of medicine into the bone. Disadvantages: inadequate of proper knowledge about the outcome of nanoparticles on biochemical pathway and process of human body. Biocompatible materials must be generate no immune response when be used. There are different risks happen although the same nanomaterials are applied dermally or intravenously. Scientists are very concerned about the toxicities issue as it might pose a serious threat to the human being and the environment. There is a big question about the result of the experiments because the standard and harmonized protocols were not followed. A universal definition for nanomedicine still does not exist and might even not be feasible at all or useful. The journey towards complete regulation of nanomedicines are still far. The ethical issue also subjected to the nanomedicine as some of the tests use animals in their experiment.